One of the most pressing health problems in the country and around the world is hepatitis. In fact, around 1 in 10 Filipinos have chronic hepatitis B and 6 in 1,000 have chronic hepatitis C. On the program today, we'll talk more about the different types of hepatitis commonly seen here in the Philippines and how they affect Filipinos and what we can do to stop it from progressing. I'm Dr. Freddy Gomez and this is MedTalk Health Talk on CNN Philippines. Hepatitis occurs when there is an inflammation of the liver. So your liver is your organ responsible for processing many things such as nutrients, filtering blood, fighting infections, just a few of them. Now our guests are here today to tell us more about this condition. With us is Dr. Edel Tripon. She's a hepatologist from the Medical City. We're also joined by Dr. Ruter Moralit, who is a gastroenterologist from the University of the Philippines PGH and the Medical City as well. Thank you both for joining us on this program. I'll start the discussion with Dr. Edel. Tell us more about this condition. Why is hepatitis primarily affecting our liver?
There are many causes of liver inflammation, and it can be an infection. That's our main topic today, and those are the known viruses for hepatitis. But it can also be secondary to toxins that we intake, namely alcohol and even some drugs or even supplements that can lead to liver inflammation and liver injury.
Dr. Edel, why is hepatitis so prevalent here in the Philippines?
You're right, Freddie. So we're talking about viral hepatitis. We say it's the ABCs of hepatitis. The hepatitis A, which is the food and waterborne hepatitis, is pretty common in third world countries. The other form of hepatitis that's very common in the Philippines and a bigger public health issue actually is hepatitis B. And it's very common in the Philippines because we're one of the top 10 countries in the world that has it, and that include adult and even in children 5 and below. And this is because this kind of hepatitis is an infection that's transmitted from mother to child at birth. And so if we don't address the adults and anytime that we drag back or lay low in our infant immunization rates, then we prevent the country from decreasing our cases.
Doc Ruter, let's start with hepatitis A. Let's talk about it. What are some of the more common symptoms and how is this mainly acquired?
Hepatitis A, as Edel mentioned, is a foodborne or waterborne viral hepatitis. So this is the one that nakukuha natin sa pagkain na madumi or hindi malinis na tubig. Main symptoms is usually nilalagnat, sumasakit ang tiyan, nauseated or nasusuka, sometimes may vomiting and bloatedness, and then eventually they develop jaundice o yung paninilaw.
Ngayon, how about food poisoning? Can someone get mistake food poisoning with Hepa A?
Yes, kasi sometimes hepatitis A does not present with jaundice, and symptoms of intestinal flu or yung kanyang pagtatae is very similar to hepatitis A. So unfortunately, unless magpa-test ka at nag-jaundice ka, hindi mo malalaman na hepatitis A pala yung nakuha mo.
Now, Dr. Edel, let's talk about hepatitis B. First, let's compare it with what Dr. Ruter just mentioned about hepatitis A. Let's compare that because they talk about hepatitis A as a self-limiting, an acute event, while hepatitis B has the risk of being chronic. Please explain that to our viewers.
When you say kasi someone has acute hepatitis, that means that you've been carrying the virus for less than 6 months. So in patients who get infected with the viruses that can become chronic, and when you say chronic, meaning you can carry it in your body and in your system for more than 6 months to the rest of your life. And we say that once you have proven hepatitis B or C for more than 6 months, that you are someone with chronic infection because the likelihood that you will get cured or lose the infection is less. So once you have it for over 6 months, most likely you will be carrying this infection for years until the rest of your life even.
That's right. So if it's something that can be there for the rest of your life, we definitely have to talk more about that after the break because when we return, we'll go through some of the causes as well as more of the symptoms so we can best prevent and manage this illness. So we're your partner in healthcare, so keep it here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to Med Talk Health Talk. We're talking about hepatitis and it continues to be a public health concern here in our country. But many of the cases can actually be prevented through proper care. Now, understanding its causes and its warning signs is the first step. Dr. Reuter, earlier we talked about the main cause for hepatitis A is fecal-oral. How about hepatitis B?
So hepatitis B is mainly from mother to children. It's vertical transmission yung tinatawag namin. So hindi siya namamana, it's naipapasa. So galing siya sa mommy, pagdaan nila sa puerta, either via cesarean or via normal delivery, na ipapasa ni mommy yung virus to the baby. And if the baby is not vaccinated within 12 hours nung passive and nung active immunization, pwedeng makuha ni baby yon for life. So that's why it's very important, sabi ni Dr. Tripon, that the immunization among children below 5 years old, especially with carriers na mommy, dapat magawa within 12 hours yung first doses.
So definitely vaccination is important. But my question for Dr. Edel, for hepatitis B, is it possible to have hepatitis B and not have any symptoms? Hindi alam ng tao na may hepatitis B na pala siya.
Yes, it's possible. So in the Philippines, the estimates is that we have 10% of our general population that has hepatitis B. And that in the time that the study was done, our population was about 100 million. So this translates to about 10 million Filipinos who have hepatitis B. And that percentage is higher in adults. So the estimate in 2003, when they did a study, about 17% of adults.
So Dr. Reuter mentioned that one of the main reasons for them for hepatitis B to be transferred is from the mother to the child. What are some other ways that are common here in the Philippines ang pag-transmit ng hepatitis B, Dr. Edel?
So other ways, the younger you get exposed, the higher the chance that you will become chronic or have the chronic infection. So things that will cause the blood of someone who has hepatitis B to enter your system, and that will include, say, sharing manicure, pedicure instruments, sharing razors. And I've seen acute hepatitis B individuals in those that are exposed to razors that are reused, blades that are reused from barber shops. There are documented cases from transmission from Bentosa, where they use suction cups for massage. And sometimes because of the vigorousness of the pressure and the suction pressure, there is some blood. And if, for example, that glass that they use is used on another person, then that can be a way to transmit the disease. Previously, if you got blood transfusion in the 80s or maybe even early 90s, because it was around that time that we started to screen organized blood banks for hepatitis B and C, then you may also have had the infection in that manner. So very old women, sometimes I see that those are the sources of infection. Say they gave birth in the 70s and had transfusion during their delivery of their baby, and we would trace back as a source of the infection, that mode of transmission.
So we've been talking about hepatitis B. There's so many mundane things that our viewers may not be aware of na pwede palang makuhang hepatitis B dito. Now I'd like to ask Dr. Reuter, how bad can it get? Earlier we mentioned that it can be a chronic illness. It can be there for lifelong. Nakamamatay ba ang hepatitis B?
When you got the infection quite early, the chances of you having the chronic disease is quite longer and higher. So the problem is you develop the complications of hepatitis B, which is in the Philippines, we do see patients who have cirrhosis and eventually die of liver cancer. So that's the most dreaded disease condition that can be a complication of hepatitis B. So yes, nakamamatay ang hepatitis B, especially if the virus becomes active later in the years of your life.
Doc Reuter, how about hepatitis A? Pwede bang mamatay ang isang tao kapag meron siyang hepatitis A?
Yes, but it's very uncommon. We have a condition called fulminant hepatitis A. So fulminant hepatitis A, there's a severe inflammation of the liver trying to clear out the virus. Unfortunately, these patients, when they do have fulminant hepatitis A, they can die. But bihira naman, awa ng Diyos. So that's why vaccination is key for hepatitis A.
Dr. Edel, please enlighten us on hepatitis C and how different is it from the other types of hepatitis?
So hepatitis C, the same as hepatitis B. So what I try to remind people is that the consonants B and C are the ones that become chronic, and they are the same in that they are the ones that are blood and body fluid borne. So hepatitis C is less common in the Philippines. It has the same mode of transmission. You can get it through sexual contact, same as hepatitis B. You can get it through sharing contaminated instruments. Very commonly, we can find this in IV drug users, especially if they share needles, even in contaminated tattoo instruments. So it's very important to ask your tattoo provider that they're using new and sterile needles.
Dr. Del, before we pause to break, how is hepatitis diagnosed? What are the ways in which doctors perform to get the proper diagnosis, and which type of hepatitis they have?
So it's very easy. It's a simple blood test. Some of these tests are point of care tests, wherein you will get your results after they get a drop of blood, and you'll get the results in like maybe within 30 minutes. In the same way, for A and B, which has vaccines, you can get tests if you already are immune, meaning if you already have the antibody and if you still need to be vaccinated.
Now that you've been properly diagnosed with hepatitis and whatever type it is, what do you do now? That's what we will talk about when Men Talk Health Talk returns. So keep it here, only on CNN Philippines. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk. Today, we're talking about hepatitis, which is a public health concern here in the Philippines. We can take action against this disease with proper awareness, number one, testing for that, as well as the correct management. Now, Dr. Reuter, let's talk about that. When it comes to managing hepatitis, you mentioned about vaccines. What vaccine should they take? When should they be taking those vaccines?
So we have three viral hepatitises that are common in the Philippines, A, B, and C. And unfortunately, wala tayong vaccine for hepatitis C. But fortunately, we have vaccines for hepatitis A and hepatitis B. So you can take them separately or even in combination. So usually, hepatitis B is being given immediately during the first 6 months of life. And it's given 3 doses. Hepatitis A naman, usually during the school age or preschool age, we also give hepatitis A to protect these patients from acquiring those infections. And these hepatitis A and hepatitis B vaccines provide lifelong protection. So once it's given and they develop the antibodies, the protection that it provides is lifelong.
Now, Dr. Reuter, for someone who already was diagnosed to have hepatitis B and has hepatitis B chronically, do they still, will taking the vaccine be any benefit for them?
So unfortunately, it would not protect them anymore because they have the virus already, and the vaccine is not capable of clearing the virus once you develop the chronic hepatitis B. So unfortunately, for some of our countrymen, nag-develop na ng hepatitis B na chronic, hindi na po kayo magbe-benefit sa vaccination.
Okay, so it's very important to be able to prevent this and taking that vaccine early on, as what Dr. Reuter mentioned, and take the corresponding doses as well. Dr. Edel, I want to talk about some of the practical effects of being diagnosed with hepatitis B. You mentioned that this has a possibility, although not always, to be a chronic disease. If there is a vaccine for hepatitis A and B, how about those with hepatitis C? What are their options now?
If we're talking about those that are infected already, now is in the past decade, there has been huge leaps in the advances for treatment of hepatitis C. There are now available tablets that can be given to you. If you have a hepatitis C infection, you need to be viremic to be eligible for these tablets, meaning the PCR test should show that you have active hepatitis C replication in your body. And if diagnosed, there are tablets that can be given to you. And usually the treatment just lasts 3 months to 6 months, depending on the stage of your liver disease. And treatment is generally 95% to over 95% effective.
Now, when it comes to testing, Dr. Edel, how important is it to know if your partner, potential partner, has chronic hepatitis B or not?
Well, for chronic hepatitis B, it's important because in the Philippines, because it's so prevalent, we can actually go out and say anyone who is Filipino should have been tested for hepatitis B at least once in their life and be vaccinated if they are not yet immune. And that is because it's a vaccine preventable disease. And actually, the Philippines has a program wherein all infants, and Dr. Ruther mentioned about vaccination for hepatitis B. This vaccination, the birth dose, is free from the expanded program of immunization, and is also free under the PhilHealth maternal care and newborn package, so that your child at 1 year of life has completed the vaccination against Hep B, and that should protect them against infection for life. Just vaccination and the giving of the immune globulin can actually decrease the transmission from a positive hepatitis B pregnant mother to her child by less than 10%. And ineligible mothers, if your viral load, so if you see your OB and your Hep B positive, there is actually available tablets that can be given from the 28th week of pregnancy. So this is the third trimester to further decrease infection from mother to child to 0.
Now, Dr. Ruther, aside from the vaccine against hepatitis A and B, what are some other ways that our viewers can protect themselves, be more conscious that hepatitis B is around?
Avoiding sharing of sharp objects, making sure that you practice monogamous relationships. And if you are not practicing monogamous relationship, use barrier protections like condoms. These are the things that you can do to prevent transmission of hepatitis B through various means. So unfortunately, the mother to daughter is only protected by vaccination. But for adults who have chronic hepatitis B friends and colleagues, or those who are practicing sexual intercourse, then practice safe sex.
Now, we all have a role to play in protecting against hepatitis and other diseases as well. So let's take the steps needed in order to prevent it from catching it. Thank you so much, Dr. Adel Tripon and Dr. Ruther Moralit, for sharing your information. We all know a little bit more about hepatitis now, which is the most important thing. So we appreciate your time and your insights very much. I'm Dr. Freddy Gomez, and we'll see you again next time here on Med Talk Health Talk.